Hi, I'm Jen, and I'm one of the massage therapists here at Reconnect Health Center.
And I'm Bethany Robertson, and I work at Reconnect as their on-site and virtual counselor.
And today, I asked Bethany if we could have a bit of a conversation to talk about massage therapy and mental health. So this is something that I am really passionate about and kind of an advocate for, that people shouldn't be afraid to talk about mental health. It's something a lot of us struggle with. And as a massage therapist and somebody in the paramedical field, want to talk about some tips and tricks and tools that you can help with to help manage your own mental health with things that come up in massage therapy. So I guess the biggest thing for starters is a lot of people struggle with mental health, myself included. And as somebody that works in massage therapy, that can be hard sometimes. So what would you recommend for people that struggle with mental health to help keep themselves grounded and to help with the transference aspect of what you deal with treating?
Yeah, and I'm so glad that you are being as vulnerable as you are, and just like you're coming right out there and saying that like this is something that you face in your line of work, right? Like, and I think there's a lot of practitioners who would be in a similar boat. And in your area of expertise, what makes what you do so unique and so different than what I do is the fact that you're actually placing your hands on people.
Yeah.
Right? And like you're feeling their energy and you're feeling like their body just like relax, and you are a facilitator of in a way like that healing aspect that they're experiencing in their body, right? But you bring up a word, transference, which I think is really important just to talk about, because maybe we just need a little reminder of what that is, and maybe there's some people out there who really aren't familiar with what that word is. But transference, it really has to do with when you're working with a client and they start talking and they start bringing things to the surface, all of a sudden you as the practitioner are starting to carry some of the load of what that person has experienced in their life. So if they've had a negative relationship with a family member, all of a sudden some of that emotion can get placed onto the practitioner. And as a counselor, that's something that I need to be aware of in my profession as well as countertransference. There's some times in a session where a client might say something to us that triggers something in our own lives.
100%.
And sometimes I can't speak for you, but I have had that temptation of, oh, like I want to like put this on my client, and we really have to hold ourselves back, because it's not just what we take on from our client, but it's sometimes what we can potentially put onto our client.
Agreed. And I think that's really important, because that can be hard when you have clients. Massage therapy is a very vulnerable situation. And I always tell my clients that the massage therapy room is a safe space. They're allowed to talk about whatever they want. And I have some really great conversations with my patients. But it's also hard that I need to remember, and I do struggle with this sometimes too, that exactly like you said, I'll have a patient that will say something and it'll trigger something for me, and it's really hard to, probably because I'm not consciously aware that I'm doing it, but kind of interject that onto the client. And where I don't want not that I don't want the transference, I know that's a bad way to put it, but I need to be aware of the transference from a client aspect, also being aware of the counter transference from from what I'm doing onto the patient too, because I don't want them to take on anything that I'm saying necessarily as well. So I think that's something that can be really helpful for massage therapists to kind of keep that separation and make themselves aware too.
Yeah. And like, don't get me wrong, I think like there has to be a boundary when it comes to like this counter transference, like, and depending on like the relationship. Again, the goal is not to put our issues, our problems onto our client, but certainly in building rapport, just saying things like, oh, I can understand, right? Or what you said really hit home for me. And then just leaving it at that. I think a lot of what we're talking about is just increasing our self-awareness in how we show up with our clients, how we show up in a counseling space, how we show up in a massage therapy space, specifically. And I think when it comes to the way that we enter into the room, increasing our self-awareness is so important, because maybe the night before we didn't get a great night's sleep. There's always a chance that somebody said something to you in your last appointment that you're still carrying. And it's really important to just do a bit of a body scan, a little check in with how you're feeling, a very somatic approach to like what's going on.
Yes.
And so with a lot of my clients, it's very common for me to assign them like a strategy. A tool is just like a scale from 1 to 10. You can fill in like the emotion that you're experiencing. It could be anxiety. It could be sadness. Maybe if you just treated somebody who is terminally ill and you're noticing that you're carrying that in your body, I like to tell people like, where are you at on that scale? And so what I will have people do, and you can do this with any emotion that you're feeling. You can literally do this with a happiness scale. But usually most people will use anxiety. I'm going to put just sadness for our example today. So if this is the emotion that you are feeling after treating a client, really just doing like a little check-in with yourself and doing a number scale all the way down to 1, 10 being like you're at your most sad. So this could be for any one person. It could be different for you than it is for me. When I'm at my most sad, I'm crying uncontrollably. I might be shaking, and really getting used to like the signs in your body to know what number you're at. Okay. The funny thing about a scaling question is we have to have like those two extremes. We need to know when we're really affected, but we also need to really tap in and say, how do I know when I'm chill?
100%.
That's a weird question. Like, I don't know if anybody has ever said to you, Jen, how do you know when you're good?
Good question.
Right? And It's like, well, I don't usually notice that in my body. So I'm going to challenge everybody to start noticing, how do you know when you're okay going into a session, right? So for me, when I'm walking into the counseling space, I do this little quick body, it is a really quick scan. And I ask myself, what am I feeling before I enter in, before I go out into the waiting room to collect my next client? So I might be feeling like my heart rate is nice and slow. I might be able to think creatively, so I don't have any thoughts that are getting jumbled in my mind. I might notice that my body temperature is like perfect, right? I'm not too hot, I'm not too cold, I'm in that perfect like Goldilocks state.
I love that.
But then if I've just treated someone who is carrying a lot, whether they're terminally ill or whether there's been a separation in the family, something to do with a child, a grieving, I might notice, you know what? My temperature's changed. My thoughts are moving faster than they were before. I'm noticing that I'm speaking a lot slower, or maybe you're speaking a lot louder if you're dealing with some anxiety. And I think it's important to know what are the signs in your body as you progress towards sadness. And when you can identify before you go in to see a client, you know what, I'm at a 5. It's really easy to jump from a 5 to an 8 to a 10. But what I've also observed is if you can catch yourself like at a 5 or lower,
Yes.
you're in more control, you're more grounded, you're more regulated before you step into that session. And so what I have gotten to know about myself, if I use something like even an emotion like anger, I've noticed in myself that if I'm at a 5, I know exactly what I need to do to bring me to a 4. So if I'm noticing I'm hot in the cheeks, I know I need to cool myself off. So I need to drink water, or I need to touch something like a cold surface just to ground me and for me to feel another temperature other than the heat that's in my body.
That's really helpful.
And just like all of a sudden I go from a 5 to a 4. That benefits me in how I show up for my clients, but it also benefits my client because I am able to walk into that space in a more regulated way. So I love like a scaling question to be able to maybe even after every client, just do that little survey of your body. What is happening right now? Is my heart rate like all of a sudden going a little faster? Am I feeling heavy? Like, are my shoulders slumping? Am I feeling tension in my own body? And really taking stock of how your emotion shows up in your body. And then you can then plug in and say, I know exactly what to do when I'm at a 6 to get me down to a 5, to get me down to a 3, that gets me in that like 2-3 zone where I can actually function and keep the main thing, which
Right.
is doing what I'm passionate about.
Being there for your patients and your
Exactly.
clients. That is really great advice. I'm going to have to start taking that myself.
I'm glad you like it. Yeah.
I find it sometimes hard, and I'm sure there's lots of other massage therapists that can relate to this as well, but sometimes, especially on like a busy day, or I'm really bad at taking that time in between my patients to just kind of like, not necessarily check out, but kind of be self-aware and check in with my own body. I lose track of that sometimes too. So along those lines, for somebody that might treat somebody that they're kind of at that 9 or 10, or for somebody that might be having a bad day, say everybody has things going on, and for some people it's easier to check it at the door than it is for others, and sometimes there's triggers throughout the day. What would you recommend for somebody that, you know, might come out of a treatment or before a treatment starts, kind of be at that 9 to 10 level? Is there something kind of that you would recommend that we could do to kind of like help bring ourselves down from that kind of extreme?
And you're specifically talking about like the practitioner.
Yes.
So if the practitioner is feeling the 10, well, I think even just having the awareness, I'm at a 10, like you're not going to benefit the client if you're in that state.
True.
Right? And I know, like, I'm not making an excuse for pushing your clients or maybe showing up late for a session. But I think we have to be honest, right? Like, our clients are only going to be served if we are showing up for them. And I know this might sound a little ridiculous, but we are the tool.
Yes, that's a good way to put it.
Like, it's not the lotion. It's not the table. Like, it's not them lying down. We are the tool.
That's very true.
And if we are not sharp, we don't always have to be, you know, at our pointiest, right? But we need to show up. And if we are at a 10, I think we need to take that stock of ourselves and say, what will serve the client? What will serve me?
Yes.
It is more beneficial to reschedule a client than to engage in a session where it's going to have us in our bed the next day for hours.
And I think that's something that's hard to kind of register as well, because I know I don't want to say guilty of this because I am an empath that has emotions up to here all the time. And I think that's a relatively normal trait with a lot of massage therapists, that there's that feeling of not wanting to let your clients down, but also being aware of how you're feeling. And I think that's really important in like even during treatments too, because I've had instances where I might get kind of subconsciously triggered during a treatment, and then I'm noticing things like, oh, my pressure is increasing, and I've had clients be like, a little less on the pressure, and it's because of like a conversation line or something that might be triggering me. So how to kind of be aware of your feelings during the treatment as well, especially because things might come up, so something to be very aware of. And
I love that you're bringing this up, because there is a difference between emotional regulation and emotional processing.
Okay.
So let's just define that a little bit. I mean, why not? We're here.
Exactly.
So emotional regulation is something that happens almost in like a social setting. It's like where we put that mask on, where we say we've got a job to do, we just need to power through. A classic example of this, and it's going to be hopefully a humorous one, would be like if you're at the grocery store and all of a sudden somebody rudely cuts in front of you. That impacts you, right? Like, that's not socially acceptable, but it's also not socially acceptable to all of a sudden turn the person around and smoke them in the face. Right?
Yeah, exactly.
And you know that there are people around you holding you to another standard.
Yes.
So in that moment, even if somebody in the aisle beside you or the line beside you notices what just happened, and they look at you and they acknowledge, like, I get it, you're frustrated, that would annoy me too, is kind of what the look is conveying.
I'm very aware of that look.
But that's what's happening in the moment is we're not trying to get arrested.
Right.
We are being regulated in the moment. Something happened to us that wasn't okay, but our social constructs are keeping us and holding us to a standard. It's the same in our job, right? If somebody is working customer service and a person is yelling, they need to stay composed, even though they might want to yell back at a customer. They just need to say, I'm going to go get my manager. They have to stay regulated in that moment, because they might be at risk of losing their job if they act in a way that's not acceptable. and they might be up for promotion. They may not get that. There are things on the line, right? And so we have learned very well in our society and in our workforce how to regulate in the moment. However, when things happen, and they do, when somebody shares heartbreaking information, when it triggers, when it reminds us of something that's happening in our own life in a session, like when we're working on a client, they're on your table, you are feeling their muscles, right? We need to be able to leave that session and then process it. And so if that means, as a practitioner, giving yourself a little more time between sessions so that you can actually give yourself a little bit of time in your day to sit down, take a sip of water, and maybe even journal, write down 3 thoughts. Wow, that impacted me. Wow, I need to talk about this with my own counselor. Wow, I need to just draw a picture of my grief right now. That is going to help you regulate. And I know that time is money and we want to book as many clients in, but that's not always the right answer. We are the tool. So if we need an extra 10 minutes in between clients, or we need, and we have the ability to see one less client a day so that we can emotionally process what is happening on our table and in that space, then I think that the value just speaks for itself.
And I think that helps kind of make us better practitioners too, because I love the, I guess, words of wisdom that I hear a lot is if you're not at your best as a practitioner, you're not going to be the best for your patients either. And the goal is to have our patients feeling better and being at their best as well. So that's really helpful. And I know for myself, sometimes when I do take that time between patients and do what I should, even for me, just to kind of like get out of my headspace and kind of regulate myself, that might be as simple as like doom scrolling through my Instagram, I'm not going to lie, because it takes me out of the headspace that I'm in. It's something that helps distract me and kind of not makes me forget, but I guess puts me in that different headspace going into the next treatment. It kind of gives me a break from what just happened, lets my brain associate with something else, as silly as doom scrolling sounds, but that's what works for me sometimes.
That's great.
Just to kind of be aware. Easier said than done, but at least I think being aware of those things and how you're feeling during treatments and after treatments, between treatments, and even before you start your day is really important as well. I love all this information. So speaking about, because we've kind of talked about those harder situations like palliative cases and things like that, I know this isn't something that every massage therapist necessarily experiences to the same magnitude as some others. We know that this is going to like kind of switch topics very heavily, but death is inevitable. People die. And sometimes, depending on what line of massage therapy you're in, end of life care can be very common or become more common. And if you've never experienced treating in end of life care or terminal or palliative situations, whether you have struggle with mental health, anxiety, anything like that or not, that can be emotionally very hard to deal with. The number one goal in end of care and palliative situations is you want to make sure your client is at their most comfortable. It's to make them as comfortable and as happy as possible for those last, say, whether it's weeks, months, or even like a year or so, and give them the best quality they can have for the rest of what time they have left. But that can be very emotionally hard. So what do you recommend in those type of situations? Because sometimes regulating those emotions and not having that kind of overtake your own thoughts and your own anxieties and things like that can be a little bit harder, because it's not, there's like a finality to those things, if that's the right word. It's not something that you're just going to necessarily get over. It's a hurdle with this patient. They'll get better and you'll see them again. You know that there is an end date, and that can be hard, not just from developing a relationship with your patients, and that that relationship is inevitably going to end. But how do you help yourself, or I guess what are some tools you have for a therapist to kind of not let that be all consuming and to better be able to help your patient through that end of life stage?
And thank you for bringing that up, because there are those instances where it is extremely difficult. And these are people that you've built relationship with, right? And so you are kind of brought into that grieving process with them.
Absolutely.
Right? And I think, you know, making it known right from the get-go, like what are the expectations of our relationship? And I think even like there is a way to address that and set some boundaries, even on an intake form when you're meeting with somebody for the first time. What are you expecting to get out of this? How do you see our relationship developing? What are you expecting of me? And then also letting the client know what you're expecting of them. You can address the elephant in the room.
I think that's really important too.
I think it is important in acknowledging what somebody is going through, letting them know what a privilege it is to be helping them and helping them find some peace in their body, I think is okay. Like I'm firm on boundaries. I talk about boundaries a lot in the line of work that I do, but there are instances where a toe over that to say, like, thank you for allowing me to be part of your journey, I think is really important. I think there is something to that connection piece with our clients. It's important for us to say, like, this is very sad. I am sad. It's important to have that goodbye, right? And even in counseling, we use the word, the last time I meet with a client, we're terminating the session. But in this line of work, it could very well be, right? A terminally ill person, this could be the last session.
Yes.
In counseling, it is not uncommon, and the client does not need to necessarily be terminally ill for this to happen. It could just be the last session that we have, the client has progressed. It's not uncommon in counseling for counselors to write a little letter to their clients.
Okay.
And it's not like a book.
Yeah.
It's not page after page. But if you know that this might be the last time that you see a client, it's perfectly okay to check in with the client and say, I wrote a letter. And it might just be a paragraph saying, I'm so proud of you. It's been an honor. And it's up to them if they receive it as a way to acknowledge the work that you two have done together. I think it's really important for practitioners to be able to offer some sense of closure to their clients. And if their client doesn't want to receive the letter, I think it's still important for practitioners to have an outlet, whether that is a counselor to talk to, whether that is writing their thoughts down in a journal, writing what has impacted you in working with this client. We need a place to process again.
Yes.
Right? Like it goes back to we're regulated in the moment as much as we can be, knowing full well that tears might come. And that's okay. That's the little toe that dips over that boundary line that I think is okay when you've established that relationship.
And kind of in that situation too.
Yes.
And I like the closure aspect because that's not always every time a patient passes away, which sounds really bad because it's not like patients are passing away all the time.
Yes.
Not every time in that situation do you necessarily have that closure. And speaking from experience, I, in a very kind of relatively short career as a massage therapist, have had numerous patients pass away very unexpectedly or due to unknown circumstances and things like that. And you always find out kind of after the fact. And there is that, like, I didn't know that was the last time I was going to see them, or it's a shock depending on the reasoning or age, things like that. And I find you never kind of get this closure. And I'm sure there's a lot of people that are in this boat too that just kind of treat it like, oh, well, this person's just gone somewhere else, or I'm never, because patients can up and leave, patients can move, and you don't always necessarily get that closure. Whereas compared to kind of end of life care, you know that there is an end date and you know that that is going to come. And I guess for me, I never thought about that like closure aspect of it. So I really like the idea of, I think that it, not necessarily a boundary line, but that kind of dipping the toe over those boundaries, because it is a very different type of treatment as well. And there are tears in those situations. And as a practitioner, I think it is important and it's completely okay to feel those emotions.
It is, yeah.
I've had conversations with patients myself in kind of end of life care where it's like, you know what, we're going to have an ugly cry day today, and that's fine. I think it's important.
Yes.
And patients, I think it makes them feel a little bit more comfortable as well, that death is scary at the end of the day. Whether you know it's coming or it's not, it's scary and none of us like to think about it. But for a lot of patients that are in that kind of terminal and end of life care state, I think in some way, and I've had patients tell me this too, it helps them be like, they're not scared to process those emotions in front of their practitioner. And it helps with part of the healing process and making them more comfortable too. But I like the idea of like a letter to a patient, whether they open it or not, having those conversations to kind of get that closure. And I guess, do you have anything else you would recommend just to kind of, from a practitioner standpoint, keep your own emotions in check? Because that's, for anybody that's never dealt with or experienced end-of-life care, that can be a very hard thing emotionally, not just because of the situation, but carrying that on with you outside of the treatment room as well. And how do you go about kind of helping to or regulating those emotions that can come along with that?
Yeah, really great question. I think it's also important to address the fact that everyone has their own experiences with death.
Yes.
So some of you listening might be in one camp where every time you have someone who is facing an illness that might take their life, like you carry that with you in multiple aspects of your life. You feel that weight. You're needing those skills for how to process after. What are the really, get Bethany on her whiteboard, what are the practical things to help manage that? But there's also a camp of you who maybe haven't experienced this, or maybe have not experienced death in your own world before. Maybe somebody has never passed away that you know. And so I think it's important to address that everybody is coming into these situations with a different experience with death, right? And so there is something to asking yourself, okay, like what's going on with me? What am I carrying from maybe people who have passed away in my own life? What is being, I don't like using the word trigger, but what is like making me remember these experiences? And maybe it's pointing to something in your own life that needs to be revisited, needs to continue being processed, needs to be grieved, because it does. That's kind of that transference, counter-transference that we're experiencing a little bit too. It's bringing something up in us. And make no mistake, like it is a difficult conversation, but it can also bring so much life into the space when people can have the conversation like, this grieves me. I'm going to miss you. Thank you for everything you've brought into my life, and having somebody actually maybe even express some gratitude towards you in how you have helped them in their care. And maybe they don't. Maybe they're not open to having a conversation at the end of a session. But I do think that there's value in taking a few extra minutes and saying like, this might be the last time that we meet, and there might be some tears, right? How has this been for you? And sometimes as practitioners, we think we need maybe, and even in life, let's be honest, we think sometimes we need more closure than we actually do. And I think that's important to think about too. Like, we don't necessarily need to be writing all of our clients' letters because that's good for us, right? Like, if we have served the client well, right? If we find out down the road that this person did pass on, I think a good technique can be to just sit down and say, how did I serve them? With the ethics in massage therapy, yes. Did I show up for them? And even writing it down, like I made space for them, right? I helped them find comfort in this area in their body, right? We embraced or didn't embrace. I'm not sure, depending on the situation, right? But like asking yourself, like, how did I show up ethically for this person? And that can give us a reminder that, you know what, we did this job. And there might be some questions, well, could I have done more? I think we beat ourselves up. There's so much that we want to do for our clients, but it's just not possible. And so reminding ourselves, what is our scope of practice?
Yes.
right? I think it's important even when we have clients on our table or in our room, just having a little bit of resources that we know of off to the side, because you cannot be their counselor.
Exactly.
And so saying, I noticed that you really wanted to speak a lot in our session today. So here are some resources in case you're interested. And you can really lean into like providing other services for them and encouraging people to seek comfort from other places. And that's also like an ethical way to show up for your clients. And I guess I think a practical strategy is always to do that check-in every day when we go to work, asking ourselves, how much energy do I have to give today?
Yes.
Right? Like, is my tank at 50% today? Am I at 75%? And knowing that at the end of the day, the goal as a practitioner is not to lay your head on your pillow at 0% energy, right? We want to be able to put our heads on our pillows and know that we've still got a little bit of energy for ourselves at the end of the day, right? And so I always get people to imagine, and real quick, because I love my whiteboard. You can take the teacher out of the classroom, but you can't take the classroom out of the teacher. But I like to give people the strategy of what are the aspects of your life that you find value in? And I'm going to draw terrible cups for you right now. But let's say in your life you value food, like good food. You value your family, time with them. Let's say you value rest, so sleeping. Let's say you value, faith. Let's say you value exercise. Okay, so if I am drawing all of these cups, these areas in life that I want my energy to go towards, and let's put work down here. On any given day, you may have a different amount of energy to spread out over those things. And so on any given day, if you know that you've got somebody terminally ill coming in, and if you value giving them a little bit more of your energy that day, then your work cup might be a little fuller. You might have more of yourself to pour out to other people. But if you know that you're going to be pouring more of yourself in work that day, you can't pour that same amount into all these other areas. So rest, you'll need your rest. Maybe your family gets a little bit that day. Maybe food gets a little bit that day. Maybe there's no exercise that day, and I'm not promoting that by any means. I'm just saying on any given day, we get to decide where our energy goes. And so if you look at your schedule, and I know so many things are unknown, but if you look at your schedule and you're like, nope, my third person today, I would like to give a little more of my energy, but that means that I'm going to take away from something else that I value, because we only have so much energy to go around, and we are rarely at 100%. Like, let's be honest, are we ever?
What's 100%? Yeah.
Exactly. On any given day, we might wake up and we're only at 65%. So that 65% needs to be dispersed among those things that you value. And I love this image of just recognizing on any given day when you show up to work, what's my percentage? How much do I have to offer of myself, of my 70%, because I didn't sleep well last night, or, I've got a big presentation that day, so that's going to take energy. Being very mindful of where we are placing our energy. And that's going to be something, again, increasing your self-awareness for how you show up for your clients and how you show up for yourself.
Oh, I think that's really helpful.
Okay.
And I know we're out of time for today. I want to thank you so much for taking the time to do this. I think it's really important as massage therapist or whatever practitioner type you are to be aware of kind of your own feelings and to really I don't want anybody to be afraid to reach out. I think it's really important to be able to talk about things, especially if you are somebody that struggles with mental health. This is a job that can be, and again, I also don't like the word triggering, but triggering for our own mental health. And when we're not at 100%, it's very hard to be at 100% for our patients, or even 70%
Right,
for our patients.
right. That's the
because
reality.
again, what even is 100%?
Exactly.
So I hope this was helpful for anybody that is a massage therapist or other practitioner type that struggles with mental health, or even just tools on how to kind of be aware of your own emotions with treatments and with some harder things that can come into treatments.
Yes.
And to not be afraid to reach out to somebody if you are struggling, or if you do need help with your emotions as well.
Mm-hmm.
Awesome. Thank you, Beth.
Yes. Thank you so much.
Thanks.